Most people think that pregnancy is an uneventful, beautiful experience, but for those of us who are on the ground, we know what can happen when a pregnancy goes wrong.
With my second son, I had an arterial bleed and almost bled to death.
My first one, he died at delivery.
Is the system equipped right now to handle more births a year?
I would have to say right now the system is not ready.
Abortion rights are under attack.
Bring them to their knees, God, in repentance.
I think abortion is abortion, no matter how we're counseled to do that.
I had been diagnosed with stage 3 breast cancer. Doctors here couldn't treat me and me be pregnant.
Nobody's thinking about women. Nobody's thinking about, our well-being.
You never know the real reason why a woman will want to go through something like that.
Oh, excuse me.
We are in the Mississippi Delta, where maternal health care is in crisis. Hospitals have been shutting down services, and there's not enough nurses and doctors here.
Let us ride. Hey, Joseph, good.
Dr. Lakeisha Richardson just got a call that one of her patients is minutes away from giving birth. She's one of only 2 OBGYNs in this area.
I'm on call 24/7, so I'm delivering my own patients. I don't have a hospitalist or a midwife who can catch a baby for me while I'm in clinic or if I'm out after hours, so it's running back and forth majority of the days.
In 2022, Mississippi became one of the now 14 states to ban abortion. And the state is projected to have a surge in births. I came here to see how more babies being born would play out on the ground in a state that ranks near the bottom when it comes to the health of mothers and babies. To see how stretched the healthcare system already is,
You ready?
Dr. Richardson in this hospital gave us rare access.
Okay.
They wanted us to see the challenges that exist in providing care in the Delta.
Take a deep breath and push.
Dr. Richardson can deliver as many as 10 babies a week.
All right, come on.
All right, take
Deep
that
breath.
Deep breath, bring your chin to your chest. And
There we go.
push.
Harder, 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 harder,
There
harder.
you go, keep going, keep
Come on.
going.
Baby.
10:49.
All right, I'll let you hold it. Come on. We're gonna cut right here.
Right in between.
Big cut. Perfect. Yes, ma'am. All right, all done. No stitches.
Hey.
You did great.
This birth goes well, and these parents welcome a healthy baby boy. But that's not always the case, especially in rural areas where women face so many challenges in accessing maternal care.
Most people think that pregnancy is an uneventful, beautiful experience, but for those of us who are on the ground, we know what can happen when a pregnancy goes wrong. I've had pregnant patients have a heart attack or a myocardial infarction during pregnancy, postpartum hemorrhage, amniotic fluid embolism, pulmonary embolism. So there are lots of things that can go wrong in pregnancy. Morning.
On the day we're with Dr. Richardson, and just down the hall, a teen mom is struggling with preeclampsia, or high blood pressure in pregnancy. We didn't film in the room because she was having a devastating experience.
Unfortunately, before we could get her delivered, the baby's heart stopped beating in utero. We couldn't get fetal heart tones, and then we did an ultrasound that confirmed that the fetus had already, died in utero. It's always difficult, it's always emotional. You sit back and you self-reflect and you put that pressure on yourself. It's like, what could I have done differently? This isn't supposed to happen in the United States in this day and age. Babies aren't supposed to die. You know, it's the worst part of the job. It never gets any easier.
Babies are more likely to die in Mississippi than in any other state. It also has one of the highest maternal mortality rates in the developed world, with 36 women out of every 100,000 dying from childbirth. And the numbers are even more startling for Black women, who die at 4 times the rate of white women in pregnancy.
For women in Mississippi, we just want the same health care that the rest of the world is receiving. It's not a lot to ask, but it seems like it's unattainable for some reason.
I report on the American South for the Tennessean, one of the largest newspapers in the region. I write a lot of stories about women's issues, and I'm particularly interested in pregnancy because of the health risks that can come with it.
Now, what are the 4 things that you keep up with if your water end up breaking? Color, the time, the amount, one more.
When Roe v. Wade was overturned, I knew it would mean more babies would be born, especially in states with the most restrictive abortion bans, like Mississippi.
So we're gonna start with our hands over our heart and over our tummy, just so we can measure our breathing.
And from my reporting, I learned that many of those babies would be born under challenging circumstances. The state projects that there will be roughly 5,000 more births in Mississippi this year. That's a 14% increase.
Is the system equipped right now to handle 4,000 to 5,500 more births a year?
It depends on where those births are occurring. Where I suspect they're going to occur, I would have to say right now the system is not ready.
Dr. Daniel Edney is the head of Mississippi's health department. He calculated the numbers and the impact of the abortion ban on the state's healthcare system.
By definition, these are unwanted pregnancies for whatever reason, which tend to be high-risk pregnancies. And in Mississippi, it's usually driven by poverty. And so when we're increasing the number of women who are already having significant challenges in life, added now to a high-risk pregnancy, we just added 5,000 more to that. I mean, we don't have redundancy or resiliency in our healthcare system in general. And if we strain that further, it's moving towards the breaking point.
Do you worry about that?
I worry every day and every night.
Dr. Edney is from the Mississippi Delta. That's the area of the state that he's most worried about. It's a rural area that has a majority Black population, and in the 1800s, it was the heart of America's cotton-growing industry and slave trade. Today, it's one of the poorest parts of Mississippi, and it lacks resources. In recent years, 2 hospitals have shut down, and others have stopped services for pregnant women. There's now only 9 OBGYNs left in an area that serves more than 200,000 people.
So keep eating your fruits, drinking plenty of water, and then wear your compression socks.
Number 12. When was your last ultrasound? Your regular fluids besides the mag, is it D5LR?
There's this pressure for me to try to make up for the difference of the physicians that are not here and try to make sure we serve everybody we can. So my schedule is overbooked. I'm not turning any OB patients away.
She's probably just difficult to control because it looked like she was running 150s in the beginning anyway, so.
Dr. Richardson runs a women's health clinic with her colleague, nurse practitioner Pat Barber. They're both from the Mississippi Delta and are passionate about helping women in this area.
Well, this blood pressure I'm not too thrilled about. So I need to make sure you're taking your medicine twice a day, and let me see your glucose log.
Together, they see an average of 120 patients a month.
With the growing number of pregnant women, it's becoming extremely hard for the physicians here in the Delta to maintain the number of patients that need to be taken care of. We're covering over 5 to 10 counties, including an additional state, which includes Arkansas.
Because the Mississippi Delta is a high poverty area, pregnant women here have more health complications, and the majority of them are uninsured or on Medicaid.
Mississippi has a lot of disparities: lack of insurance, socioeconomical status, lack of education, lack of fresh fruits and vegetables. So if you put the disparities with everything else that's going on, you can see why mothers are at high risk.
If you have any pre-existing medical conditions, high blood pressure, diabetes, hyper or hypothyroidism, obesity also increases your risk for complications in pregnancy. And then unfortunately in the Mississippi Delta, teen pregnancy is also considered high risk.
But fluid looks good, placenta looks good. He has plenty of time to turn.
Lacey Lowry is one of Dr. Richardson's high-risk patients. She's 23 and pregnant with her third child.
Yeah, have you had any experiences where something's gone wrong or something just felt not right?
With my second son, I had arterial bleed right after I had him, and I almost bled to death. Oof. I was at home. I woke up and there was a lot of blood. I thought it was just a normal, bleeding after pregnancy. It took them 2.5 hours to get the bleeding under control.
Wow. How did you feel while that was happening?
Oh, I was terrified. I didn't know what was going on. I didn't know if I was going to die. I didn't know if I'd see my kids.
What problems or roadblocks have you had with your current pregnancy?
Well, the first 5 months, I stayed really sick. I couldn't eat, drink, anything. I had to go to the hospital, get fluids. My legs have cramped a lot. I've just had a lot of issues going on.
The women we spoke with at the clinic say they trust the care they're getting with Dr. Richardson, but there was still a lot of fear and anxiety.
No bleeding, no leaking in the fluid, good appetite.
Yeah, it's all right.
132. Baby sounds good.
Physically, it's been good because he's been growing properly, but mentally, it's just like, paranoia, anxiety, especially anxiety, because you think like, oh, is my baby gonna be okay? I just wanted him to get here healthy, so.
And some of the stories they told us echo statistics that point to Mississippi being one of the most dangerous places for mothers and babies.
My first one, he died at delivery. Had a lot of complications at delivery. I've had some miscarriages. My first living child, everything went smoothly with her. My second living child, he had some complications, or I did. I was preeclamptic, so that made me high risk for these. And then when we came for this one, and they were twins, and I'm almost 40, that just increased it.
And when there are complications in pregnancy, women have to drive over 2 hours to get to the closest big city.
This one's happy. 153, 158.
You don't really have many options, and there's not a lot of resources. And we're losing our resources in this area. We only have 2 OBs in Greenville.
This is not New York. This is not Atlanta. The nearest hospital is not 30 minutes away. And we're not talking about 6-lane highways. We're talking about nowhere to stop between here and the nearest hospital being 1 hour to 2 hours away. I mean, can you imagine being in labor or your water broke and you're huffing and puffing for 2 hours hoping you make it to the hospital in time? So when you're already serving a high-risk population, and then to add the shortage of physicians and the shortage of hospitals, you begin to see how desperate we are for more physicians and more prenatal care in Mississippi.
Maternal mortality is on the rise across the United States and in Mississippi, and more than 80% of those deaths here are preventable. But despite this being one of the riskiest places in the country to be pregnant, the state has been leading the charge with some of the most restrictive abortion laws for decades.
Bring them to their knees, God, in repentance. that they would come to repentance and the acknowledging of the truth.
Abortion rights are under attack. Abortion rights are under attack.
Sir, you stand with the evil here.
And the Supreme Court case that led to the overturning of Roe v. Wade originated here in the heart of the Bible Belt. Today, Mississippi's ban on abortion has only 2 exceptions: in cases of documented rape or when a mother's life is in danger. An hour outside of Greenville, still in the Mississippi Delta, we find a woman who wants to share her story, and it doesn't fit neatly into the law. This is Shirley, and she asked that we only use her first name.
So when you got pregnant last year, what was going on with you?
I had been diagnosed with stage 3 breast cancer. I was actually at the end of my immune therapy treatment when I found out I was about 4.5 months pregnant. And it turned my world upside down. I was real shocked when I found out, but I was even more shocked to know that doctors here couldn't treat me and me be pregnant.
Do you remember how you felt at that moment?
Oh. I'm a very strong person, but hearing that really just took a toll on me. I really didn't know what to do or how to think, but I knew that if he's telling me this, it's for the best.
Even though Mississippi has an exception to its abortion ban when a mother's life is at risk, the danger has to be imminent. And the threat of Shirley's cancer didn't qualify.
I'm torn up, but at the same time, I'm listening to my doctors tell me that if I don't go through with the termination of the pregnancy, then I might not live because of the kind of cancer that I have. It's a hormonal cancer. And me being pregnant will increase the rate of my cancer returning. I got 4 other kids, so it wasn't a question about whether I was going to terminate the pregnancy or not. You know, I felt that it would be selfish for me to continue the pregnancy knowing that the outcome could be that I'm not here to raise my other children.
Rock, paper, scissors, shoot.
Shirley says she could never have imagined she'd get pregnant while undergoing treatment for cancer, and she didn't realize until she was 18 weeks along. There were no nearby states where she could have an abortion legally. Today, there's a patchwork of abortion laws and restrictions across the country. 14 states, concentrated mostly in the South, ban abortion in almost all cases. Another 5 states have partial bans on abortion before 15 weeks of pregnancy. And a handful of states have bans that are tied up in the courts. In Mississippi and across the country, there are underground networks of people who help women get abortions out of state. One of them helped Shirley find a provider and paid for her travel to New York City for 4 days.
The sky is blank.
The sky is blue.
Okay.
On a December morning last year, she drove 2 hours to the nearest airport.
How quickly did it happen?
All within a week. I found out one day, and a couple of days later, I was gone.
Did anyone come with you?
No. I went alone. But then I wanted to do it by myself. I tried to block everything out and just continue on like it didn't happen. I did a lot of things to just take my mind off of me actually having an abortion. You know, it's still a lot, but I deal with it the best way that I know how. I ask for forgiveness, but it still hurts.
We struggled to find women like Shirley who would share their story with us, because abortion's not something people speak about openly here, and public opinion is split.
Do you believe there's a difference between a woman who has a fully elective abortion and a woman who has an abortion when the doctor has told her, you're going to die if you stay pregnant?
I mean, I don't think so. I think abortion is abortion, no matter how we're counseled to do that.
And what about when, the woman is told that there are medical conditions that she will die giving birth?
I think we have to leave those things in God's hands.
Pastor Matt Alexander runs the Hope Center at the First Baptist Church in Greenville in the Delta.
This is our room for children from infant on up. We tried to divide it by sizes.
It provides help to many poor pregnant women and mothers who struggle to afford the basics for their children.
My first message to our congregation was the hard work that should have been going on before this is really just now beginning, that we can't just say this is a victory for us. This means that now we have work to do. We have ministry that needs to happen.
Is it fair to cut off abortion as an option for women when so many women here have a hard time getting prenatal care and, some lose their babies, some lose their lives?
It goes back to that belief of valuing life from the womb to the tomb, that if we're going to celebrate this decision to cut off this option of abortion, then we've got to connect these women that may not have those healthcare options. Then we've got to step in and provide those.
In Mississippi, the restrictive laws go beyond banning abortion. They also hold the medical professionals accountable. The penalty for performing an abortion deemed illegal is up to 10 years in prison.
I didn't go to medical school to have to think about going to jail. That's just not what we do. And most physicians don't go into healthcare, wanting to harm patients.
What impact has the overturning of Roe v. Wade had on your job?
For me, I think that it's caused a lot of anxiety for just me in general, or just OBGYNs in general, just trying to navigate this new landscape of how do we take care of women who are now in circumstances where either the pregnancy jeopardizes mother's life, or we've had an instance where mom has had preterm premature rupture membranes or some other complication in pregnancy, but there's still a fetal heartbeat.
What Dr. Richardson is describing is a situation where a woman has to carry an unviable pregnancy, a case when the fetus has no chance of surviving but still has a heartbeat.
When you think about mom's emotional distress, just to find out that this is not a normal pregnancy, that this baby's not going to live, and to have to go through that for 9 months. Nobody's thinking about women. Nobody's thinking about our well-being or our emotional well-being or our health or our mental status when they make these laws and they decide what we can and what we can't do with our body.
When the government sits on their high horses and with their gavels and make all these decisions, they really don't think everything through. Every pregnancy is not the traditional pregnancy. We have gotten into the habit to where it's either right or wrong. There's never a middle ground that we tend to meet in.
After Mississippi banned abortion, there were cries on both sides of the aisle for the state to improve maternal health care.
Right now, we don't invest in public health very well, and we're not investing in the health of our communities. We're not putting health as a priority, and we're paying the price. We don't have to be at the bottom. Somebody does, but it doesn't have to be us, and I'm determined it won't remain us.
This year, the state passed a law that would extend Medicaid insurance to poor mothers for the first year after giving birth. But the state still has one of the highest rates of uninsured Americans, and 1 in 6 women of childbearing age have no health insurance.
I think that every citizen in the United States deserves adequate health care. They deserve access to health care. They deserve to be insured. We need help, and it's not because we're not working. We're doing the very best we can with what we have.
I think all mothers across the United States can sympathize how much and how important it is to receive good quality health care, to have a good, healthy outcome with a pregnancy.
Hello, how are we doing? All right. How's everything going?
Dr. Richardson says she will continue to see any woman in need in the Mississippi Delta.
I'm from the Delta, and so one of the reasons why I wanted to go to medical school is because I wanted to come back home and practice medicine. And so I'm passionate about it because I want the people of my hometown to receive the same health care that people receive in New York, Chicago, and Atlanta. That's all I've ever wanted for Mississippi and the Mississippi Delta.